before I focus on communication across the lifespan, the question I was going to ask was what for you? Oh, we have another participant, Arden. Wow. So I'll just get this going on here. Sorry. Hi, Arden. So, in terms of when you think about communication, what does effective communication look like? So I'm just going to be typing it out. And I like to do a top 10 list because in your mind, what does effective communication look like? When you know it's been worthwhile or you've had a conversation that you felt where you were acknowledged or it's been productive, what do you think the elements of what makes good communication or effective communication? I'm just gonna let's just do a brainstorm, and I'm just gonna type out. So do you have any feedback to me regarding that? And then I'm just gonna talk to that, and I've got a little bit of information because it's almost like when we have a therapeutic interview or we're trying to do therapeutic responsiveness. It's very similar having these life conversations with people because a lot of the skills that we learn in nursing you can apply to life because you learn how to communicate with all ages across the lifespan, right? But I'm going to break it down into sort of the skill piece because effective communication is it, you have to be it's skill building. It's something you learn over a lifetime or over your practice. You don't just, wake up one day and you have um, you're comfortable talking about death or you're comfortable about um, talking to someone about their abuse experience or what was it like to have that interview. So what I'm saying is I'm just curious what you think effective communication looks like. How would you know if communication was effective? Either one of you, just throw
I
out.
guess it's like, if there's like a speaking, listening kind of dialogue going on, like that kind of dance between two people that, so one person's listening or one person's talking, and acknowledging that, what's being said. That
Acknowledging, yeah. So, do you guys believe communication is more speaking or more listening? What would you say?
I would say listening.
Oh, who said that? Was that Arden or Karen?
Karen.
Karen. And are you an introvert or an extrovert, my dear?
Introvert.
Okay. Okay, so maybe introverts have the scoop on it. It is more listening. So effective communication means it's not even about actively listening. It's actually focused acknowledgement. And what I mean is, you've set yourself up so that people can see you, people can hear you. You're within a safe comfort zone. You've set up an environment that promotes people wanting to talk to you. So it is more about listening. Because if you can't listen, then what you're doing is you're just talking, and that's not communication. Communication is what you guys said. It's a back and forth kind of dialogue that's going somewhere, right? It has a purpose. Well, sometimes we don't even have a purpose. We're just curious. But that honestly is the beginning of a good conversation. So acknowledgement. Anything else? We've got speaking, listening, acknowledging. Is there anything else you think is a
and the question is like, what makes good communication?
Or effective communication? I'm going to
Effective.
Yeah.
Yeah, I don't. That's a good question.
Sorry.
Yeah, go ahead, Karen.
I would say like the message that the sender wants to get across is like received properly by the other person.
Oh, interesting. Okay, so I'm just going to put the message. I'm going to put acknowledging, and I'm going to put the message. No, because seriously, you can do prep even as a nurse in health promotion, or even as a teacher or as a professional. You can come prepared, but I'm always aware of not so much my body language, but the intent by which I go into the communication. Because people are sensitive to the body language. People are sensitive to the nonverbal. People are sensitive to the eye contact. People are sensitive to the space we give between people. People are sensitive to the environment that you've set up to engage them in, right? So the message is important, but if you haven't set up all the other, like if you haven't set up the environment and you haven't introduced yourself and given people space, then the message can get really lost. You know what I'm saying? Yeah. So the message is interesting. So I'm going to get back to the message. Anything else?
I don't quite know how to word it, but it's like effective communication is successful when you kind of achieved what you went in to achieve, right? So like you're finding out what you're trying to look for, or you're problem solving. Yeah, achieve purpose. Thank you. So simply said.
No. So achieve the purpose. And sometimes the purpose is simply meeting the person and having an introduction and then trying to move into the conversation. But everything leading up to the intent of what you wanted to discuss has to be focused. If you understand that, like effective communication right from the get-go is acknowledgement of the person, right? And then slowly using different types of techniques to draw the conversation out. So, yeah. Okay. And then I'm going to add to this because I think there's an informal and formal process in terms of effective communication. And sometimes we have to start informally to get to formal, or sometimes we start formal to get to informal back to formal. Because as a professional, as a nurse for a really, really long time, and I say this all the time, it's all how we do beginnings and endings, entrances and exits, because we never know when we're going to meet that person again. It's the same as if you're, you got a new boyfriend, a new partner, and you're going to meet their family for the first time, and you get really anxious or really nervous, or like, your first date or an interview. What's really important is how you come in and introduce yourself, because people's comfort level, I think people get to know you initially within those first few minutes. You know what I mean? Yeah. Sorry.
Yeah, sorry, Brenda. I'm just gonna unmute my mic for.
Sure. Okay, Karen, is there anything else you want to add? You're pretty good that you got listening. That was good.
Nothing that I can think of right now.
Okay. Okay. All right. Speaking, listening, acknowledging the message, the purpose. Okay. Formal, informal. Okay. Okay. I'm going to put body language. I'm going to put safety. I'm just going to add to my list. And I'm going to put nonverbal. So what I'm trying to do here is think of when we're successful in communicating, all of these points are in some way acknowledged in terms of we've performed them, they were a part of the conversation. So it's acknowledging the person, it's in the introduction. What is your purpose? What is your role? Why are you here? And I think the biggest piece is your intent. Are you curious? Because I think many of us do things to task because we think that's what's expected versus focusing on the person. So, in nursing, if you focus on the person as the disease, you're missing a lot of what the person's experiencing. So it's the same. If you're meeting your instructor, you know they're an evaluator. You know that they want to know what your strengths and weaknesses are. So you have to be open to that. You have to be open to having a conversation. So I think, yeah. So that's the other piece. That's openness too. Speaking, acknowledging. I think there's different ways to deliver the message. Whether you deliver it in a handout, whether you deliver it during the discussion, whether you use other material to say it, that piece isn't as important as all of the body language, the acknowledgement, the skills that you use to have the conversation. And I think in terms of safety, it's just really important to have a relaxed atmosphere when you're having a conversation, especially at the beginning of life and at the end of life, like the two ends of the spectrum, right? Like when you're sitting down with families and children, or even when you're sitting with children, like 0 to 3, or you're sitting with older adults, it is much better to get close to them so that you can, like for kids, so that they can climb on you, they can touch you, you can play with them. But it's the same with older adults that have hearing or visual deficits. It's important to be able to sit close enough and create enough space between you that they can hear you, they can see you, and if need be, you can move closer or you can move a little back. But it's how you use, so part of it is how you use interpersonal space. Yeah.
Would you add question?
Yeah.
Would you add trust into there?
Okay, so yes, that's important. So trust, and then I mean part of what goes. So I'm just gonna jump in because so we're gonna do trust building, which is rapport building. So yes, so you got to start with rapport with anybody. That is like the number one. So being able, like introducing yourself and saying why you're here, and then spending a little bit of time just doing very informal, superficial kind of conversation. That's important to just start to build the trust. So like it doesn't matter, even if you're a nurse in a hospital or you're meeting a neighbor down the street. So how was your day? Um, so it's lovely today. So you got any plans for today? You know, the thing is, it's that kind of conversation gets us into people's space, gets us starting to talk to people, and we don't do that enough because we're so focused on trying to deliver the message or the task that we forget that we're strangers most of the time. Even with our loved ones, it's not like every single day, right? We're always around each other, right? So what I'm trying to say is, and people, we don't know what happens in other people's days. So it's always better to have a repertoire of skills. So I always, when I'm meeting strangers or even within my own family, I'm always aware of like checking in. So the first thing I do for rapport building and trust building is I do check-in. So how was your day? How are you? Anything? What's new? So you start off informally and then you start to build into the conversation. Like then you can start to go into the more formal process. So you start informal and then you move into the formal, right? And then even by just saying, how was your day? Tell me what happened. Do you want to talk about it? Or even when you're having any type of conversation, when you show interest in somebody else, then most of the time they'll have interest in you and then you can start the back and forth dialogue. So, and I always use body language. I try to look like I'm open, like solar, right? So you sit within a certain space, you know, give each other like almost like social distance, almost like you give each other like 6 feet, but you use that space to move in or out, right? And you can also, like, even if you're going to bedside as a nurse, or if you're going into a preschool, or if you're meeting, you know, somebody's family for the first time, or you're meeting a kid for the first time, it's always good to plant yourself somewhere where you're close enough, but you're not so close, right? So like it's how you use interpersonal space, interpersonal distance. Don't put yourself far away from somebody, because if you're more than 6 feet away, you can't hear. You know, it becomes a shouting match, or you don't know how to use interpersonal space. You don't know how to move in or move out. So you have to get really comfortable with how you use your body to convey a message, right? So I think it's really important that, you know, effective communication across the lifespan is how open you are to receiving what other people have to say, and then questioning and exploring. But we'll talk more about that. Anyway, I'm trying to think. Yeah. Yeah. The other thing is there's so many of us, we don't have trust. Unfortunately, there's a lot of professions, especially healthcare, where we assume a lot of intimacy with somebody right away, but we forget that we're strangers. You know what I'm saying? And even when we talk on the SkyTrain or if we're on a street corner, you know, we still have to give space to people, right? We have to start informally and then move into something. Um, you know, I'm always curious about people, but I usually greet people and then I'm like, so what do you think of that? And kind of have a minute or two of informal, then I just get into a discussion if they want to. So I don't know. Yeah, achieve the purpose. So the other thing that I think you have to consider is the time you have. How do you use the time in the conversation? Now, some people they don't think about time because it doesn't matter. But I think if you can't convey a message or you can't convey acknowledgement in the first few minutes, then I don't think you get to trust or rapport. So I think it's very important right from the get-go that you're facing somebody kind of in an angle, that you make sure, like if it's an older adult, right, they've got glasses on, they've got hearing aids. Most of the time, people have glasses, people have hearing aids, older adults, but they don't wear them. People don't, right? So even if you want to ask people, that's not something you would ask normally unless you were in a clinical setting, but you wouldn't use it. Because I know a lot of people have apparatus, but they don't like to use it. Now I see you using it, Karen. But not everybody does, because not everybody wants to acknowledge weakness or aging or, right? So, you know, you got to give people time to get to know you. And if it's an ongoing relationship over time, you'll get to know somebody. So then you can ask them to put on their glasses. I mean, you can do that right from the get-go if people can't see you, but not everybody's going to tell you, right? So I mean, I'm just trying to think of the older adult. And it's the same with kids, like 0 to 3. I mean, there's some kids, like maybe 2.5, they might have some verbal skills, but the biggest way to get into a kid space is really to sit down and play with them to get to their level, right? So you got to get down on the ground, or you got to use toys. You got to engage somebody first. So that's how you build trust and rapport with kids. You use whatever they use to communicate. You can use books, stories, puppets, but you got to be open to that, and you got to be open to giving and receiving. How can I say that? A lot of, you know, like nonverbal, symbolic kind of messages. Like with kids, if they give you their favorite stuffed animal, you know what? You've got a friend. Or if they kind of get closer to you while you're talking to their parents, that means they're curious. So then at that point, if you're talking to parents and you've got the kid, then you acknowledge the kid, and then the parents start to feel comfortable. So when you're looking at across the lifespan from 0 to 3, because I did pediatrics for like 12 years in community, and the way often interviews are conducted with parents is you want to start off by asking parents, well, tell me more about your child. Tell me why you're here. Tell me what you've been going through. But the reality of it is, I always acknowledge the child first. I always have like, you know, drawing paper, crayons. I always have things that children like 0 to 6, like up until grade 1, that they can use to express themselves, because kids are really good at expressing themselves through drawing, through stories. They can relate to puppets. Like kids are really used to play. So if they can play while you're talking to their parents, or they've got something that gets them to focus, they can still be a part of the conversation. They can be hearing what's going on, but they can still be included, but they have the choice about how they participate. So that's really important, is to give that room to kids. Now, what I learn about that is that you start to see how parents react when you give some space to kids. So some kids are going to really interrupt. Some kids will sit really quietly. Some kids will go more towards one parent than another. If they're siblings, I like to watch how that is. So sometimes, I'll ask if an older sibling wants to sit at the same level as the parent, or would you like to participate? Would you like to play? Like, and I'm talking about school age kids. So in a family, so if you have a younger child, like 0 to 5, 0 to 3, really, because preschoolers can participate. And then you have like school age kids 6 to 12, you get a real mishmash of responsiveness from children. And then you start to see, if you're working with families, where some of the struggles are in terms of communication, because you're going to start to see one parent or two parents try to encourage the child to be quiet or to participate or for them to answer questions. But sometimes what you see is you see nothing. So the parents are depending on you to do a lot of the behavior management, say, in the interview. And um, that's hard to deal with in terms of communication. So it's sort of easier at that point to let the parent be the one involved with the child. Like if you've got a disrupted child, or a child that's anxious, or a child that wants involvement, then it's better to give it to the parent, or to have one parent who's maybe less anxious, or one that you see it is better at um, you know soothing the child, hold the child, or get involved with the child. And then honestly, in terms of setting up for a successful or effective communication when you're dealing with children and families, sometimes I'll break up the family, because there could be an anxious parent, a frustrated parent, there could be marital challenges. And so I'll ask one parent to step in or out, right? And I don't give people the choice. Sometimes I do and sometimes I don't. It really depends on um, what I'm doing. What is the purpose of the communication, right? The other thing I would say about effective communication, you can do a lot of observation before you start doing the talk. Like, and you get that as an introvert, right, Karen? And I think most of us don't spend enough time observing the process. And it does make some people uncomfortable when you observe. Like, it's the use of silence. See, as soon as I stop talking for 1 minute, that's a lot of quiet. And I use quiet, I use silence, and I use nonverbal when I'm trying to promote understanding, or trying to, how can I say, convey warmth or empathy. Uh, the other thing that I do is I slow my rate of speech. As I'm starting to get into discussions, I slow my rate, I change my tone, and then I start to get a little bit closer to the person. Very much like I'm doing with you guys right now. Because I'm starting to convey that I value you and I value what we're talking about. And then it's the use of different therapeutic techniques, or different kinds of question answer techniques, in terms of trying to share information or get information, or I don't know. Yeah. Anything? So that's actually a nice list. It's a nice list. Is there anything else? I think I can stop sharing that list. What I want actually what I wanted to share with you guys is Arden, what are you in like what program are you in? Are you in nursing or healthcare
Yeah,
or
I'm in the nursing access program.
oh okay, so is that what is I don't know about it.
It's an LPN program. It's just I'm a care aide, so it's kind of a little bit of a fast track
Oh
because
okay.
I've already I'm already registered care aide. So
Okay.
yeah,
And
yeah.
have you started the program? Are you finishing? Are you halfway through? Where are you at?
Oh, I'm at the beginning of it. I started at the beginning of February,
Okay.
and it's a what and it goes for 1 year. So
Oh, nice. Good.
yeah.
Okay. Well,
So yeah, we're just really getting going now, right? We really, yeah. So
okay. Okay, good.
yeah.
All right. I'm just going to try to get this up. So, guys, I take it for granted. I'm trying to get this. I'm trying to use the technology because I was going to show you a list of techniques, therapeutic techniques here. So I got to get this up here. Sorry. So maybe I've done it wrong here. So congratulations. So I've been a nurse, Arden, for like 40 years. Like I started when I was a baby. So I just interviewed everybody, talked to everybody. I've worked in acute care VGH. I worked at Mount St. Joseph's, primarily in the city. I've worked in community mental health. I've worked in public health. I've worked in home care. Um, I've taught nursing at BCIT for a couple of years there in first year. And I've done some online, and then I've had a lot of clinical groups over the years in different settings. And so for me, I have to be really comfortable in my skin. So if I'm going to interview anybody, I have to deal with my anxiety and frustrations ahead of time. I can't go into a situation, particularly with patients, feeling stressed out. And what I say to the students here, if you show up to work and you've got personal problems, you got to leave them behind because every single person that we see, whether they're well or sick or any of us, we sense one another's discomfort. You know what I'm saying? And so we have to be really sensitive to everybody's verbal, nonverbal message. Like successful communication means you know how to put that personal stuff aside to focus on what's present and in front of you. Like that is
Yeah. So being completely present with that person.
mhm.
Yeah.
Yeah, no, seriously, that is super important. And we don't acknowledge that enough. Like we really don't. Um, yeah, I'm just trying to. Sorry, guys, I'm trying to get this WebEx meeting going here, so I'm just trying to see how I'm using the technology here. So I'm sharing this content with you. Okay. There it is. Okay. Okay, there it is. Okay. So, and you guys probably have something similar. So these are just techniques, but they work. I would say the best and most effective techniques that work are clarification and paraphrasing and reflection. But I'll just talk to a few of these, and then if you guys want to ask more questions. So using a broad opening statement is to anybody. Is there something you want to talk about? Do you want to talk about it some more? So how was that experience for you? So I've heard a lot about it. Tell me more about your experience. So like giving people lots of room to throw or to express whatever it is they need to express in the moment. We don't acknowledge that enough. And we think we just have to go for, so I'm taking your vitals, I'm doing this, I'm doing that. And you want to just explain right away to people what's wrong with them or what you're working on. And honestly, it's much better to start off. So like, how was it last night? How was your sleep? Or, so tell me more. You're a mother of two. So how old were you when you had your first? Like, So tell me what it's like to be a parent. Tell me what it's like to be married or single or a widower or to have cancer. What was your experience with cancer? So like just really broad statements. That's really important. So the other thing that we talk about a lot is using general leads, but you don't really have to use general leads. Um, it's more like acknowledging. It's like we don't give enough acknowledgement to just shaking your head in a positive way. Uh-huh. Yep. Okay. And then you can, because you can always stop a conversation and say, okay, I need to clarify something, or can I review this with you? Or can I, so I need to, can I try to understand this better? So that's when you get into reflection, because we often reflect each other as human beings. We mirror each other. So if you have a gut response, like we always talk about trying to read the nonverbal, if you see something that doesn't make sense between what people say and how they act, so can you tell me more? Or you can put your hand on them and say, I'm just wondering what's really going on. And most of the time, people will tell you, because people want to be able to express what's bothering them, or people want to share. They just don't know. So that's when you guys were talking about acknowledgement. So it's how you read the nonverbal. And until you get really comfortable with doing that, sometimes communication can be challenging, because you think you have to be so formal in the process of doing an assessment or having a therapeutic conversation. You don't, because you have to be focused, definitely, like with your head to toe. That's different. But when you're starting to have conversations with patients, what you really want to do is get that therapeutic rapport going. And sometimes it's easier just to be Karen or Arden than it is to be the nurse, right? So there's professional boundaries and then there's human boundaries. So you have to know in communication when you're a professional and when you're not, right? And it's really good to tell people sometimes where those boundaries are. Like if somebody expresses like affection towards you and you're in this like a nurse patient relation, like it would just be like if you saw somebody on the street but you weren't attracted to them, or you like somebody but you don't know that it's appropriate or inappropriate, you just say, I'm flattered, thank you. And this is the relationship that we have is really nurse patient. So what I'm trying to say is it's always about acknowledging the relationship and the boundaries, right? And you really have to call people out on their behavior if it's inappropriate when you're communicating. And you need to also create some space and time between people if you're feeling uncomfortable. So we won't talk about the safety with your patient, but if somebody's making you uncomfortable, it's better to say, excuse me, I'm not feeling comfortable here, or excuse me, I have something else to do. Thanks for the conversation. Thanks for listening. Walk away. So the reason I say that is because you should trust your gut in conversations. The other thing is if you are talking to somebody and the conversation isn't moving, then stop. Get out of the conversation, do something, and then come back in. Take a few minutes break. We don't talk about that enough, but that's important to move the conversation along. So do you guys know what I mean by reflection? Have you used that as a therapeutic technique, or do you know how to use reflection at all?
I'm just familiar with the personal reflection, like reflecting on, well, in this circumstance would be on a conversation I had, for example, with a patient, and how did that go? And, kind of evaluating. So that's,
Yes, that is. But okay, so it is a little bit like that. Yes, we reflect on like the interaction and what we got from it and where we're going to go with it. But we use reflection every day in terms of if somebody walks in into your house and you're not in a great mood and they're not in a great mood, reflection. like that's not a time that we're going to have a conversation because they're reflecting your mood, you're reflecting their mood. So you use your observation and maybe some conversation to try to get a sense of whether that person even wants to engage in a conversation with you, right? Because it's like if you go to bedside with a patient and they seem grumpy, tired, you can't, you have to do more reflecting on what's going on with that person. And you have to trust yourself to know whether you want to explore that or you want to assess that. Is this normal for the person? Is it not normal? You don't know them? Then I wouldn't do too much reflection. I would keep the conversation superficial until you spent a little bit of time, even a few minutes with somebody, because you have to have your own sense of personal safety in the conversation, like in the communication. Like I don't think we give enough credit to trusting ourselves in our own ability to have a conversation. So people that are honestly sometimes, and I said this to the class today, every nurse has strengths and weaknesses. Some nurses are great with the technical skills. I love assessment. I love having conversations with people. I love finding out what's wrong with people. I love acknowledging people. I'm very curious and I love asking lots of questions. So I don't have a problem asking lots of questions. And then you have a systematic approach, and then health interviews, taking health history becomes like second nature. Yeah. So, I mean, yeah, you can reflect on the interaction, but it's more a personal reflection of what you think is going on between the both of you, because that's human relationship. And it's kind of an ongoing evaluation of a process, right? Communication is like what you were saying, it's a process and it evolves over time, right? Okay, so yeah, so all of these skills that we learn in nursing, guys, we can apply them to life. So things like reflecting, okay, selective reflecting, you're trying to understand what's going on. Let's just move on. I'm just gonna pick and choose some. Sharing observations. So whether you share it with the patient or you share it with other staff, like I was noticing, or right now I'm seeing this. You want to tell me about it? Do you feel like talking about it? So whether you use feedback, it's how you use your observations in giving and receiving feedback. Plain and simple. Does that make sense? It's how comfortable you feel sharing your observations. So over time, it gets easier. So interviewing techniques get easier over time. And when you're getting evaluated by instructors or, honestly, guys, if you guys, you want to practice communication, it's good to practice with people who know you, who really aren't in healthcare. Say, can I have like maybe 15 minutes? Like we'll go have coffee or invite people over and know nothing about their day, know nothing about anything, and ask them to be thinking about something and then do a question answer technique and practice your interviewing skills. See how far you get in the conversation. Because informal, you need to have an informal way of connecting before you go into the more formal process, right? And honestly, most of the time we only have a few minutes to build that trusted rapport with people. A lot of patients and even staff you don't know. You know what I mean? People will like you or not like you in the first few minutes, or they're willing to give you the benefit of the doubt. They don't have such a negative impression, or you form an impression on somebody. Don't hold on to that impression. Be open to the dialogue that you get, engage in, be open. It's really like, especially in nursing, guys, because there's so many things that we talk about. So you talked about it, acknowledging each other's feelings. That's really important. So things like I can relate or I can't relate. Um, it really doesn't matter how you acknowledge. It's just that you acknowledge. That's the most important thing. And like, how do you use silence? It took me a really long time to do this, guys. particularly because I've helped a lot of people die. I've done euthanasia. I've been with families where there's been conflict. I've had disclosures of sexual abuse, physical abuse over the years. And silence is something you have to learn to put into practice to give people space to express emotions, especially those scary emotions. Like when you're seeing a lot of the COVID, the doctors saying, "Oh, people can't say goodbye to their loved ones if we have to pull them off the ventilator." Um, Sometimes all you have to do is just hold somebody's hand and just let them express themselves, or you just sit with them for a while. And if you count off within a minute, most people will say or tell you what's going on. Or if you ask a question and you don't get an answer, you can come back to it later. You can say, well, I still have to ask that question, or I might come back to it later. But if you're not comfortable, we can move on. But why don't we just take a few moments and just sit? It works. It really works. And it's not appreciated enough because we feel so like driven to get the information when it doesn't really matter, because sometimes you're going to be time limited. If you're doing an admission and you've got like other workload, you'll get part of the admission done and then you'll come back to it later. So it's not like silence is something that or time limited limits your conversations. You have lots of time for conversations, and sometimes little conversations can lead to bigger conversations. Do you know what I'm saying? So, okay. Okay. So what would you like to know? What would you like to know? That's a good question. If you were helping yourself deal with this situation right now, what would you want to know? What would you need to know? Ask the patient, because you've got all the health promotion literature there. People can only absorb bits and pieces of information at a time. So you give them a little bit. Okay, do you have any questions? You give them a little bit more. Because then you move into clarifying. It's a natural process. These are natural skills that if you're communicating effectively, you move into naturally. Okay, so do you have any questions about that? Okay, let me clarify with you. Or can I ask you a few more questions? Right? Verbalizing implied thoughts and feelings. Honestly, all that is, and for someone like an introvert like Karen, it's extroverting the thoughts. Can I ask you a question? How are you feeling right now? I'm sensing maybe you're a little frustrated or you're feeling a little helpless. But I don't know. Is that something you want to share? Is that something you're comfortable sharing? Because I appreciate it when you share that information. It helps me help you. So you've taken the negative, you put it into a positive, you inferred or you implied from it, and the person's like, well, how did you know? Because you're using reflection. If I was in your situation. So that's when, if you can use empathy and compassion, like if you got into this nursing gig to be empathetic and use compassion, then you use that experience, you use that reflective technique to get into someone else's experiences. Bada bing, bada boom. You're on your way. And you're not afraid to ask the question, because a lot of nurses, especially when they're starting out, or even doctors or new social workers, you're like, oh, can I ask that? Of course you can. You need to ask that. You need to clarify. Because frustration and anxiety are part of the process of dealing with death, trauma, and illness, or dealing with something that's uncomfortable, right? We all walk around carrying a lot of thoughts in our head. So when you're focused on a person, you want to ask what's going on. You want to find out what's going on. Sometimes you're going to hit it and sometimes you won't, but you have to be open to having those conversations with people. Okay. Oh, look at that. It moves into exploring. The reason I laugh at this, I never look at the handouts, but I think in the natural flow of a conversation, this is what happens. you get what I'm saying? You just start having that dialogue with yourself or with somebody else. Like if you were to have a conversation with yourself in the mirror, Arden, right? You'd be looking at yourself wondering, what is the first thing you'd want to know? Tell me something about you I don't know. What a great way to get into a therapeutic conversation with a patient you're meeting for the first time. And then you can say to them, well, I know stuff about you that you don't even know that I know. I know your date of birth. I know what you got admitted for, and I know what I'm here to do, which is to help support you to feel better. There you go. In less than 3 to 5 seconds, I have taken an intimate stranger and made them my best friend. Guys, that's effective communication. Using reflection, therapeutic questions, and acknowledgement to describe your role, to describe your boundaries, and to bring them into an arena that allows you to do your job. It's how you use the skills. And over time, it's how well you listen and try to make sense of the behavioral responsiveness. Any questions so far? Do I seem like I know what I'm doing a little bit? Maybe. Yeah. So like, honestly, guys, I mean, I've had to deal with people that say, you know what, I don't want to deal with my ALS. I'm struggling dealing with my memory loss. Do you know, Brenda, I'm dying. And that person who said they were dying is a single mother of 4. And what does this mean for my kids? And I said, do you want to sit down and talk about it? Do you want to take a few minutes? So I've thrown my agenda out and I've said, I'm there for somebody. And then I have a therapeutic conversation and all they say, they'll acknowledge, they'll say, I just wonder what's going to happen. Like, who's going to look after them? No one is going to look after them like me. I wonder how they're going to remember me. And I said, well, that's totally valid. That's what I would be thinking too. Because we don't think about these things until they happen to us. And I think when you're having conversations with people across the lifespan, you have to give credit that they know what they need. It's just that part of your job in any kind of conversation is to try to bring out the inner experience, right? And acknowledge it. So we talk about the inner and outer experience. So often for me, conversation isn't about question and answer. It's trying to understand what is the message? What is that we're trying to convey here? What is it that I'm trying to understand? Because I can start off with a message and then I could end up with a totally different, in a totally different path or direction. But as long as I'm collecting information that I can use constructively and effectively towards somebody's care or for further advancement of a care plan or having a conversation with another team member or having further conversations with the family or the patient, then I consider it worthwhile and effective. If that makes any sense. Okay, so yeah. Okay, 5:54. So it's again, and then I gave you that exploring or delving further. Tell me more about it. Okay. So this is this presenting reality. I don't know. I mean, it depends on the setting you're in, and it really depends kind of on the conversation you're having. If you're having a professional conversation, a serious conversation, then you have to just live with the reality. Like if you're in a critical care environment, there's lots of noise. If you're in a 4-bedroom versus a private room, if you're in somebody's home and it's very dirty. The reason I say that is because everybody has their own sense of reality. And so the best that we can do when we're trying to set up for successful communication is just set up an environment where we can have a comfortable conversation, or we can have a dialogue where we can hear each other. So, I don't know, reality. Yeah. I don't use all of these. I don't doubt statements. Well, people can hear it in my tone, definitely over time. So you can use the nonverbal. I use a lot of handshaking. I use a lot of hand gestures because sometimes I don't quite believe what people are saying. Because sometimes I think, especially patients or when people have to share hard information or people don't want to share information, they get resistant or they get silent or, there's more going on. So I'm just, okay, well, I'll accept it. So usually what I do is I just accept people's responses. And then I'll say, okay, well, maybe we can talk about that later. Or, maybe we can explore that another time. Or maybe there's another way I can say it. Maybe I'm not getting what you're trying to um, tell me, you know? But you have to feel that out because people are sensitive. And if you go on too much about something that people are really sensitive about, or what I would do is in terms of reality or doubt, I would just say, it seems like that is something that you don't want to talk about right now. So I acknowledge the reality and I'll say, maybe that's something we can talk about later. We don't need to talk about it now. If you're a parent, Arden, or Karen, if you got a sibling or a mom, when you're talking about your parents, like, I honestly, I don't want to talk about it right now. And that's okay because you don't have to get everything in one conversation. You can do bits and pieces. Like effective communication is giving people their space as well. Okay, so validating. Validating, acknowledgement, building trust and rapport, giving people some time and space. Like honestly, in 5 or 10 minutes, if you can't have a conversation with somebody and make them feel comfortable and engaging in some kind of back and forth dialogue, then you're better just to be quiet, do your task, walk away and come back. Because you're just not, see, remember too, you have to remember the person you're having a conversation with or the people you're having a conversation with. We don't know what's just happened. We don't know what they're thinking, what they're experiencing. So oftentimes we don't give each other enough space to be able to validate. We just want to know what's going on. We want a question. And I'm going to tell you that's one of the major challenges with a medical model or in a professional business environment, that there's hierarchy and there's, and I don't want to say pedagogy, but there's like expectations of what the communication's about. And realistically, the best conversations, you throw out the expectations and you get into a discussion, and then the message is lost, and then you gain so much more in terms of information. And then you'll be surprised how much information you gather. The other thing that I always have with me when I'm interviewing, like all the time, is I always have a notebook and a piece of paper so that even when people are answering me or I'm engaging, I'm observing and I'm writing all the time. So if you're like, honestly, in your nursing, I have the notebook, not even the cheat sheet for assignment. I have a notebook. I'm going to be 60 this year, believe it or not. I have a notebook in my purse that I've been carrying for the last 50 years, 51 years. And I'm observing and I'm reminding and I'm thinking so that if there's things I want to get back to in the conversation or if I want to clarify. The other thing is, if people are shy, if people don't know you, if you have a notebook, then you can stop and then you can look in the notebook. And that gives them a moment to pause, reflect, calm down. Okay. So do you mind if I just go, I just remembered you said this. Can I just try to clarify that? And then they think you're professional or they think you care. You don't have to, but it's helpful. And it gives you a lot more authority sometimes. Like you can change a whole meeting if you're the recorder. Like in a professional meeting, whether or a client center case conference, if you hold the Cardex, or if you've done any volunteer work, guys, or you've done any group work, when you're the one writing, you can ask people, excuse me, can I just go over that point you just made? Or can you tell me it in another way so I can get it? When you put something in your hand that requires you to record or write, you can slow down the conversation. And the other thing is, it's how you use this too. So even if it's not a form, there's lots of ways you can collect information that you can put on a form. So when you're first starting out and you're doing a health assessment or you're taking health history, you want to fill in all the blanks. But once you get into it, first and last name, date of birth, alert, oriented, then you just move in. So you're experiencing pain right now. Okay, are you comfortable sitting that way? Should you sit up? You know, get them into a space. So I have to ask a few questions. Do you mind? No. Mm-hmm. So, and we'll just take a few minutes. And if it's too many questions, just let me know. If you want to tap me or you want to raise your hand, yeah, doesn't really matter. I mean, as long as the other thing is, guys, you can add other techniques in there. So if people don't speak a language, if people use alternative, okay, so what they don't teach you in nursing school. So grade 5 literacy. Most of us need grade 5 literacy, reading, writing, and arithmetic. So I always ask people, how far did you go in school? Because you're going to meet immigrants, you're going to meet people that come from refugee camps, you're going to meet people that don't speak our language. We don't have the same language. So can you read and write in English or can you speak in English? Because most of the time, we don't have an interpreter. It's always in the textbooks, but in reality, we're using whatever we have. We're using images. We're using Google Translator. Thank God for cell phones now. You can put things in. I use a lot of pictures. So the same things that you would use for kids, you can use with older adults. You can use for people that don't speak a language. If you see an emoji, right? The pain scale. There's many things that you can use that can start a conversation. You can use visual aids. So it's how comfortable you are bringing in those kind of things into your dialogue or your interview. So I would say use whatever you can to get the conversation going, to build rapport, to get the dialogue back and forth. Yeah. I don't know what else I could tell you. Okay, well, maybe we should just look to end with things that aren't helpful, which is always interesting. I don't know where it is. Okay. Sorry, guys. I don't know if I can do this. Okay, so I'm just trying to figure out what's here. No. Oh, hi, Rebecca. Nice to meet you. And I can't get this down here, guys.
Nice to meet you, Brenda.
Yeah, I'm just going to talk it. Okay, so a lot of newbies, like, I don't know, Rebecca, if you're in healthcare. So a lot of newbies, what I mean is when you first start in the profession, in any healthcare profession, you want to reassure people. You want to say everything's going to be fine. Forget it. Only the sick and dying come to us. Even when we go into people's homes, it's just acknowledge the present and in the moment. Acknowledge that they're there and they're present. That's it. You don't have to say everything will be okay, because if it's a woman and they've got breast to bone mats, everything's not going to be okay. And they're smiling for you. Like, that's not what we're there for. I'm here to perform a task or a duty or responsibility. So I want to know what's going on with you. Or I'm having a conversation with you today, and what we're supposed to be talking about is this, but I can sense, or am I sensing that maybe there's something else you want to talk about? I don't know. But don't provide false reassurance and say things are going to be okay, because we don't know how things are going to be. To be really honest, guys, we don't. In healthcare, Rebecca, are you healthcare?
No, I am the ECE student.
Okay. So when we were talking about, like, even when I work with families or kids, because I was a pediatric nurse for like 12 years, I really learned to acknowledge the children, and then I would focus on the parents, but I would always try to focus on the parent who was the least anxious.
Yeah.
And then I would try to address the other parent as I got into the rapport building with the family. So the bottom line, guys, is from 0 to 3, you do most of your question answer in any type of therapeutic conversation or in communication. You do it with the parent, but if you can involve the child in the process, like with the parent sitting on the lap, playing with them, getting them to come near you, and then going back to the parent, then you know that the kid is trusting you. And if the kid starts to trust you, then the parents trust you. That's the bottom line. You understand that. And the other thing, if you're doing ECE, you understand about observation and the power of observation and sharing those observations. Because you know what you do in ECE is that you say, okay, so I noticed that your kid is putting the toys up and down or like tidying up the environment. It's like, are any of you like that? Where would they have gotten that from? Or did this just come out of, this is something you've never seen in your family? Because they could be like very disorganized parents and they got a kid all of a sudden who likes things organized. What I'm trying to say is, if I'm curious, I'm going to ask those questions because I want to get to know the child. So who is the focus of the conversation? What is it that we're trying to um, gain information about? It doesn't really matter, guys, because in any kind of conversation, if it's therapeutic, and if it's effective, people will share with you back and forth because they know that they can trust you. So if you can build trust over time with having conversations where they feel acknowledged and they feel heard and listened to, then you don't have to do reassurance because people will just bring their problems to you, right? But yeah, I'm.
Thank you.
Yeah. So I don't know if there's. I was trying to see because a lot of the students that we see, they come from Asia, and their whole culture is very different than the North American model, which is more about open inquiry. And we do a lot of health promotion. We do a lot of teaching. Like we're very direct in North America. And so it's not even about confrontation. We just ask questions. And most of our kids are taught that way, to be curious. It's called critical thinking, right? When we apply critical thinking to our communication, to our questions, then it allows for the dialogue. And the other thing I would say is don't do a long conversation. If you have to have more than an hour with somebody, take a break and come back later. If you can't, you break up conversations into bits and pieces. Take a break, come back. It's okay. Yeah, and I'm sorry I can't get this. Oh, there it is. It's moving now. Okay. Let's try to get this. So false reassurance. Okay. Don't give advice if it's not yours. If you want to give advice, but honestly, it's better to help people explore their own ideas all the time. That's more important, honestly, guys. It's more important to help people explore than it is to give advice. Because if you give advice, then you have to be the one to deal with the problem. Like you're not helping people figure out how to deal with the problem on their own. Because our roles often are just to provide structure and boundaries to people. Like even with helping people understand how to manage their children or to come into a classroom to engage kids in a task. It's often our best form of communication is to observe and to be there and then spend a few minutes. Can we share some of these observations? And do you want to talk about what was going on? Demanding an explanation. Okay, so honestly, it's just about maintaining some level of neutrality or not bringing your values or opinions into the conversation. This will happen over time, like many years. It's not good in the beginning to start to introduce what you think is right and wrong. Yeah, giving approval. I don't think there's too many. I think it's okay to disagree with someone. I don't talk a lot about belittling someone, but I think it's okay. Like sometimes it's okay to say, I have, like when it's not related specifically to an intervention that's like a psychomotor or medical treatment, it's okay because it's important to acknowledge that we have differences, and that's okay. Because we all come from different places, whether it's a different culture, different experience. We all handle situations a little bit different. So I'll give you an example. If there is abuse going on in a home, and I'm going to end on this. If there's abuse, because I worked a lot with kids that have been abused, okay? There's some kids that can ride the abuse. They know that every day they're going to get out of their home and there's going to be a different world out there. And they know that they learn at an early age that what mom and dad do is they fight, or mom and dad put each other down, and I don't want to be around it. So they avoid it. They stay in their room. They develop coping strategies on their own, separate from their siblings or separate from anybody else. They develop coping strategies to distance themselves from the arguments or the abuse. And it's an innate personality. It's their personality traits. There's other kids, they don't want the fighting. So they're going to go right into the space between their parents and say, stop fighting. They're going to scream. They're going to act out because they think maybe it's something they did that was wrong, or they just want to distract. The reason I say that is because every single person on the face of the earth comes from a different family, comes from a different culture, comes bringing different childhood experiences to any kind of conversation, any type of communication. And we don't know that person till we know that person, till we know their history. So whether we're in a professional or personal capacity, you should always give people the benefit of the doubt that people have experienced both positive and negative experience from which they learn from, or from which they repeat negative patterns. And you don't know if anything you say or do is going to trigger a negative response. So you should be prepared to set your boundaries around what is safe and what is not safe for you. So in terms of your own reflection, know who you are and know what your comfort level is in terms of asking questions, in terms of acknowledging other people's experiences. So know your own competency. And in fact, it's okay to say, I'm new to this, right? Like, this is my first daycare. You're one of my first patients. Yada, 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 yada. People will help you usually. Right? Anyway, I don't know. I don't know if this has been helpful, but these are things that we do. And once you learn how to master them and use them, your job becomes so much easier. Effective communication is just being open and listening, and then trying to engage in some type of therapeutic communication where you use empathy and compassion to guide you. You use observations and inquiry. Okay.
Thanks, Brenda.
Okay. Do you guys have any questions or want to have any further discussions?
No.
Okay.
Do you have your chat box open? Do you have the chat box open? I just sent you a thank you.
Okay. Well, thank you guys. Good luck with everything.
SprottTalks.